I think one step is to appreciate that there are different causes of tinnitus and likely different mechanisms. And so it's unlikely that one pill is going to help everybody. And so the important message there is that it's important to try and make distinctions between the different patients and subgroups of patients. And we can do that. A lot of my research in psychoacoustics noted that, for example, for some people, you play a noise, you cover up their tinnitus, you turn the noise off after 10 seconds, and the tinnitus is gone. But for other people, it makes no change at all with their tinnitus. I think as a first step, connecting with somebody to realize that they're not alone, to realize they're not making it up, to realize that the reactions that they're having are reasonable is an important first step.
One of your core contributions to the tinnitus community has been tinnitus activities treatment, which is a protocol that you and colleagues developed to help guide patients towards reduced tinnitus, towards habituation of the perception of tinnitus. Can you tell us a bit about why you created that? What was the original problem or the circumstance for why your team created tinnitus activities treatment?
Well, initially, and of course, I started this work with my first job in the United Kingdom for the Institute of Hearing Research, and there were just people beginning to get interested in tinnitus at that point worldwide, and not a lot of options for treatments, and not a lot known. And there were, a lot of people trying different electrical activities and different stimulation sites, and but not connecting to the patient and not counseling. So there were various people starting up different counseling strategies, but I didn't appreciate them. I didn't think they were as meant. I didn't think they connected as well to the patient as they needed to, and I didn't think they accepted the individual differences that are available. So when we all have challenges, we all react in different ways, and tinnitus can affect people's lives in different ways. So I think the first step in connecting with the patient and understanding what kind of counseling is needed is to see where the individual patient is at and what kind of problems they're experiencing with their tinnitus. So they're all different. So we have to understand where the patient is at as a first step. And that led us to develop our tinnitus activities treatment.
What's the core teaching with the activities treatment?
Well, so the primary starting point is to appreciate that there are four different areas that can be affected by tinnitus. Everybody's different, but potentially they can be affected in their thoughts and emotions. They can be really upset with this. This is terrible. Why is it happening to me? They can have trouble getting to sleep at night. So they go to bed into a quiet room and there's a sound that they have no control over in their head. And that's a problem for sleeping. Also, concentration. So when people are trying to read or focus on a hobby or do something at work, they can be distracted by their tinnitus. So that can be very disruptive. And then the picture-based counseling in the individual four different categories helps people move forward and learn things that can reduce the prominence of their tinnitus, that can help them sleep at night, appropriate for everybody, including the use of sound therapy in the bedroom. But, the different areas, including hearing and concentrating and being upset by tinnitus, these things need to be dealt with because they can be very disruptive for your life. So having counseling sessions, we would often start off with a counseling session and go over the four areas, find out the most difficult one, and then show them our pictures and our strategies for dealing with thoughts and emotions. They have homework to do. They go home for a couple of weeks. They come back, we go over their homework, and then we go on to the next area. Okay, this is important for sleep. We go over our slides for our sleep help and talk about sleep and what problems they're having, some strategies that they can use. They go home with this homework. They have things they can keep track of. and then they come back in 2 weeks. So we do that with all 4 of the different subcategories, depending upon the individual differences.
Mm.
So they come in for the clinical visit. We go over what the program involves. They go home with some assignments. They come back in a couple of weeks and we go through their homework, and then we start on the next strategy. And of course, this can be done remotely these days. And also, we sometimes ask them to bring their partner. That's part of the issue if they have one. So I should also say that sometimes we actually start off with a group session. So with the group session, and we approximately do this once a month, with a group session, we would have people come and say that if you want to, you can bring your partner and we're going to do this. And we sit around a table, and then I give a presentation about the problems and about the possibilities of helping these patients. And one of the nice things about this is that the individuals with tinnitus see that they're not alone, that there are other people suffering from this. They can see that they're having similar problems to what they're having. And maybe it's worse, maybe it's better, but they're experiencing similar problems. It's also helpful for the spouse to see that other people are going through this as well. So that initial group session is a really important starting point, if that's a possibility, to show people that the responses they're having are reasonable, that other people are dealing with this. And we go through this as a first step, and then individual therapy follows.
Mm. I know that's so important to have a protocol, have a system to follow. There's some different models for tinnitus, and whenever someone works with an expert audiologist, like my team or like the doctors at the University of Iowa, they know that based on the audiologist's guidance, they'll be brought through a protocol that has a high likelihood of success. How would you define success in terms of tinnitus treatment? In my eyes, the average person comes to us with, say, a 6 or a 7 out of 10 intensity tinnitus, and they're aware of it, say 80% of their waking hours. How do you define success? How do you set expectations for what does successful treatment of tinnitus look like?
Well, in our model of tinnitus, in our psychological model of tinnitus, we make the distinction between the tinnitus and the reactions to the tinnitus. So there are some things that we can do with sound therapy that sometimes actually can change the prominence of the tinnitus and reduce that. But the counseling with tinnitus activities treatment moves forward with the reactions to tinnitus. And we have developed a questionnaire, the Tinnitus Primary Functions Questionnaire, which we give to people at the beginning to see where they're having problems. And we can offer that at the end as well to show them how they benefited from the treatment in different areas. So that's the way that we quantify this.
Hmm. And let's say that a patient's asking you, what is it going to look like if I'm better? How do you how do you describe the potential benefits, whether that's, the reduction of the sound volume or the reduction of the awareness of the sound or anything similar to that? What would you set the expectations there for in terms of what's the real world benefit of a successful treatment?
Right. So again, we have to make the distinction between the tinnitus and the reactions to the tinnitus. So sometimes in the sound therapy we use, the actual tinnitus itself can be reduced, but that doesn't happen all the time.
Mm.
And so I think it's really important to say that we're here to help you. You're not alone. We might not be able to change the tinnitus itself, but you can change your reactions to the tinnitus, and we can help you change those reactions. Everybody in life has challenges. There's always stuff going on, but there are things you can do to improve your sleep. There are things you can do to improve your emotional reaction to this. And part of that is realizing you're not alone and that there are some other people that have this, and that there are some activities you can do to not notice your tinnitus, for example, as often during the day.
If you follow Treble Health and get value from these videos, I would highly recommend that you watch the full video from this clip right here, or subscribe to this clip's channel. Every little bit counts, and your support means the world to me. This is Dr. Ben Thompson with Treble Health.